welcome to American Black Journal.
Thank you for the invite.
Thank you. I'm honored to be here.
Yeah, it's great to see you both. So Willie, I'm going to start with you. I think at this time, somebody who's working with people who have mental health stresses and issues has got to see that for everybody right now, this is difficult. This is unusual. It's stressful. Whether you're somebody who is close to someone who's sick or has died because of this, or just living in an environment where that is what's going on around you all the time, and you're enduring all the changes that have happened in our lives since this started, I think it touches everyone in a really profound way.
Yes, it does. And what makes it so challenging, it's a complete culture change that we have to make instantly. Other individuals in other parts of the world are already accommodated to wearing masks, social distancing. They've dealt with these issues before. Whereas with our culture, especially in America and in the Black community, it is a completely new culture change of being isolated, having to wear a mask, understand the importance of wearing gloves. So it is completely new. And that is why you can see the impact in Michigan, especially in Wayne County, are so drastic because of that culture change and so many other dynamics that are out there.
Yeah, that cultural difference, those cultural differences that you have with African Americans in particular, we're a social people, and that's the way we relate to the world and not just each other. And so this idea of staying apart, this idea of not interacting physically with each other if we do see each other is just jarring, and especially at times when you're dealing with loss the way we are. One of the things that I find myself feeling each time someone I know dies because of this, or someone who I know experiences that loss, is just almost a physical reaction in my gut that we don't get to do the things that we would normally do to mark that kind of thing happening for us.
Oh, for sure. Not only that, but we're not even able to spend the last moments with loved ones, or see loved ones, or have services, as you mentioned, simply because we cannot gather. And so many people in our community have to make the decision either to expose themselves, go out and make income, or not expose themselves and not have income. So the economic disparity in both finance and healthcare is really being shown in this virus.
Yeah. Hodari, you're a military veteran and somebody who has dealt with anxiety and depression brought on by stress and trauma. Tell us about your experience, and then tell us how you're experiencing what's going on now.
Yeah, so as someone who's diagnosed with PTSD for the last 7 years, for me, my experience comes from combat, but also the transition of coming back home and trying to just de-escalate from the military environment back to what we call the regular civilian life. That was a huge transition for me. It still has been a transition in different areas, but now with the coronavirus, one of the things I've noticed myself, even before it hit the height here in America, was like, people going to the store and just buying everything off the shelves like it's the end of the world, really put me in a fight or flight mode, and really had me going through different transitional phases of trying to practice some of the things me and my therapists and mental health counselors have been working on. And even right now, one of the things that I've had the difficult really just trying to deal with is really just to keep appointments. So instead of having that face-to-face appointment with my mental therapist or my mental health counselors, we've had to go through Zoom calls or telephone conference calls and you know, me, but one of the things that helps is just, you know, being able to just continue to talk to someone during this period. But it's still, as you mentioned, it's still tough because in the African American community, we're used to those face-to-face interactions and those face-to-face communications, because that really helps in the process of really dealing with depression and anxiety as well as grief overall. Like you mentioned, I've definitely dealt with a lot of losses. Every time I keep hearing a loss on almost a daily basis, it's tough to really dissect that. But luckily, through the different contacts that they provided me with, I'm able to have that 24/7 access, even just to talk things out, not necessarily to always, you know, be depressed or to think about what's happening with me, but just to get stuff off my chest that as I'm dealing with the grief, as I'm dealing with my own issues in my mental health battle. That helps me out a lot and keeps me going so that I can keep a sane mind right now.
Yeah. Give us a sense, Hodari, of how you're doing. I find myself asking everybody that question. How are you doing? How are you managing all of this?
So it's like, I'll say the last couple of days has been a little tough. I lost a good friend of mine. He was one of my fraternity brothers recently, and that set me back a little. But as Mr. Brooks mentioned, you know, it's a disparity because I still have to, I work for the Department of Veteran Affairs in the hospital. So I still have to go to work on a daily basis to make sure the hospital is clean and make sure we're able to deal with, for the first time in our history, the veterans hospitals that actually are accepting non-veterans into the hospital facility. So a lot of areas of the hospital were shut down to deal with COVID-19. Myself, I'm still having to go out there to make sure I put food on the table for my family and myself. So mentally, it's been draining lately, but mentally and emotionally it has. Physically, I'm in good health, but it's just a mental and emotional drain lately has been really taking its toll on me here and there.
Willie Brooks, talk about the role that your agency is playing with people like Hodari Brown right now, the kinds of things that you're having to make available. Talk about the digital divide and how that makes it more difficult to adapt to some of the strictures that we have to get used to.
Well, you know, as you know, we deal with individuals with mental illness, substance use, developmental disabilities, and individuals that we serve are more subject to occurring this disease. And therefore, they not only require physical health care, but they require the mental health care that goes with it. At Detroit Wayne, we have on our website ways to help individuals cope. Anyone can get on our website, dwihn.org, and receive information on how to cope. We're also providing personal protection equipment. You know, you hear that term PPE to our providers to help them through this process. And there's a couple of things that people should understand. One, this is not a 2-week process. This is going to change the way we interact for at least 12 months to probably 24 months. Mm-hmm. Even if a vaccine is found soon, it's going to take 12 to 18 months to get that out. So we have to prepare ourselves for the future. Wearing a mask, social distancing, taking precautions are going to be a part of our life, just as it is other parts of the world that we're looking at now. So we have to prepare ourselves for that. The other thing that makes it difficult is we're dealing with something that's almost like terrorism. It's a random act of violence. No one knows who is going to hit. So even if the numbers, for example, of COVID-19 do not exceed the deaths for heart failure, the fact that it's so unpredictable and that it can hit any age range, any person, it brings on a sense of terror. So you have to try to correct that with having a lot of facts and reality in your life. You know, it is not helpful to look at COVID-19 from the time you wake up to the time you go to sleep and just looking at the numbers. Yeah. You know, life has to continue in some form. You have to have some form of normality in your life, and you have to try and put things in perspective.
Yeah, that's something I find myself struggling with right now. The first thing I do when I wake up is look at my social media feeds. And I always do that. But right now, what that means is taking in what's happened overnight, taking in the news of the day about coronavirus. The last thing I do before I go to bed each night is look at my social feeds, and it's the same thing. And the mental wear of that over the last 5 weeks, I'm finding overwhelming. I just can't imagine what that will feel like a month from now, or as you point out, a year from now.
Yeah, and you have to keep in mind that the majority of COVID-19 cases are mild and moderate. That's why the hospitals are sending so many people home who test positive and just simply telling them to quarantine themselves. There is that small population, as we know, that it has fatal impacts on. And even though it is fatal, we still have to learn how to try to put things in somewhat of perspective, because, right now we have more people who are dying from heart disease than COVID-19.
Sure.
But you're not waking up every day and counting everyone who died with heart disease. You're not doing that. So while it is a true fact, we also have to look at the reality of the situation and learn to deal with it, as so many people have to do throughout the world. Because again, this is not a 2-week situation. This is more like a 2-year situation, and we have to prepare ourselves for the long run. I'm telling my staff, I need a 2-year plan of how we cope with this for 2 years, meaning that we're going to see individuals and staff who acquire the disease and how we're going to handle that for the next 2 years.
Yeah. Hodari Brown, we've got just a few seconds left. I want you to talk about what you would say to someone who's really stressed out right now, someone who's experiencing anxiety or depression as a result of trauma, the way you do. What would your advice be?
My advice to someone who's experiencing trauma, depression, anxiety, or even overall grief right now is to really seek out help. There's many contacts out there. The Detroit Wayne County Integrated Health Authority is one thing. You also can reach out to an organization I work with called NAMI, the National Alliance of Mental Illness. And then even reach out to your own personal care provider and see what resources they might have for you and contacts they might have, because therapists and counselors are still on the job doing virtual calls, doing telephone appointments and things. So really, and then talk to your friends and family, reach out to them on a regular basis, either through telephone, go beyond just text messaging and social media, even do a Zoom call and other teleconferences. Those are really helpful during this time. I find myself when I'm down or I'm feeling a little bit of anxiety or depression coming on, just reaching out to someone that I could talk to and I know they just listen. Those are some important things I would encourage people to do, but don't go through it by yourself, because everybody right now in this pandemic is really going through a little bit of grief, anxiety or depression at some point or another.
Yeah. It's okay to say you need help. That's great advice.